All right, hey there, and welcome to MS201 Lessons 11 and 12 on Intermediate First Aid. My name is Captain Silver Beatty, and I'm an APMS at the University of Montana Grizzly Battalion, and I'm going to be leading you through this lesson today. Now, before we even start, if you've watched my videos, you know that QR code is going to take you directly to a live website version of this exact same lesson that you can use to go through on your own and access some of the clickable embedded links and videos within this lesson. It's also going to give you the most updated version. Depending on when you're watching this, it's being recorded in October of 2024. If you're watching this in a different school year, there may have been some slight changes to the curriculum, and that QR code will lead you to a more updated version. Now, keep in mind that this lesson is a combined one of 11 and 12. 12 is actually technically a practical exercise, but it goes over information about a couple other things that aren't included in lesson 11. Now, the practical exercise, of course, you're listening to me through a computer screen. I can't lead you through that. That's going to need to be a hands-on practical exercise. So I encourage you to speak with your instructor, your advisor, maybe some people in your program, and see if you can get some hands-on practice with what we're going to go over during this. But do understand that a lot of the information, minus the practical exercise, is being combined for both 11 and 12. Now, I also encourage you, as always, to have a piece of paper out, pen and pencil, maybe a Word doc off to the side so that you can take some notes. This is a pretty intricate lesson, but we're going to be watching a lot of videos within it as well, which might seem a little odd. But you do want to probably take notes on some of this because it is stuff that you should be doing and understanding as basic and intermediate first aid exercises. But you may end up being on maybe an aid and litter team where you should already know the steps. So writing it down just helps get that more solidified within your brain. So let's just jump right in here. This is a lot of resources on this slide. You'll see that there's the read ahead. There's also the 5 videos linked on this slide that we're going to be watching if you stick with me through this. Then you've got some instructions for the DD1380 and the actual card itself, which we call the TCCC card or the Tactical Combat Casualty Care card. And then even though we're not going to talk about it too much, there is a couple links there that'll take you to a MEDEVAC Request Card and the instructions for how to fill one out. Now, if you just scan that code on the last slide, you'd be able to actually click through all of these and it'll take you to those resources. All right, so jumping in, what do I want you to be able to get out of this lesson? Well, by the end of it, I want you to at least be able to explain how to apply a hemostatic dressing and then be confident in demonstrating that after going through the steps. The same thing applies with applying an emergency bandage, applying an occlusive dressing, using a rigid or Fox eye shield, and how to perform first aid for burns. Now, we're also going to walk through the steps of filling out a DD Form 1380, the Tactical Combat Casualty Care card, or the TCCC card. And we're going to talk through the actual performance of casualty movement and what that looks like. Again, I can't encourage you enough to take this lesson and go out and see if you can find some people to do actual practical hands-on practice with as well. All right, so anytime you see a slide that says think about it or what do you think, I really encourage you to actually take the time to pause the video maybe or just reflect on the question that I'm asking. And the reason is I totally understand how difficult it is to learn through a computer screen with some random stranger talking at you. I get that. It's hard to stay engaged. It's hard to appreciate the material. So that's why I do encourage you to stop the video, listen to the question, reflect on the question, maybe even write your thoughts down just to better get yourself involved with what's going on to give you that deeper appreciation and just actual purpose for going through the lesson. So with that, why do you think it's important to understand the fundamentals of first aid? Now, keep in mind, this lesson is intermediate first aid, meant specifically for sophomores or MS2s. The MS1s, the 101 curriculum, actually goes over basic first aid. So hopefully you already have an understanding of those steps. But if not, I encourage you to go back, learn a little bit about that. That's okay. It's not going to affect what you learned today. But knowing that there's basic and intermediate, that equals the fundamentals. Why are those important? Well, we do know that a thorough understanding of these fundamentals of first aid can actually save a life, right? That's kind of the point. If anything, it can help prevent permanent disability and even reduce long periods of hospitalization through preventative care by simply knowing what to do, what not to do, and when to do the right things. So let's talk through our first process here. We're going to talk about applying a hemostatic dressing. Now, there's a lot of steps to this, so we're just going to go through them, and then we're going to watch a video that explains it in a little bit quicker time. Now, the first thing we want to do is conduct what we call body substance isolation. And with that, then you're going to remove the clothing and any equipment that might be in the way to access the wound. Now, that equipment could entail weapons, maybe ammo, their ballistic vests. There's a lot of things that can be involved with the equipment that could be in the way that we'll need to remove. Then you want to identify the point of bleeding. Now, you can't do that until you remove clothing, because just because a shirt's soaked in blood or pants are soaked in blood doesn't mean that you can see exactly where that blood's coming from, right? Step 4, we're going to take our combat gauze and we're going to pack it directly over and into that bleeding source. And we're going to pack the entire wound with that whole dressing. Now, moving into our next 5 steps, you're going to apply direct pressure for 3 minutes. Remember, 3 minutes. After that 3 minutes is up, you'll bandage the wound, securing that dressing in place, and then secure that bandage in place with tape. The next step, you're going to have to record that treatment on that Tactical Combat Casualty Care card, or the TCCC card, and then, of course, request medical evacuation. All right, now that we've gone through steps 1 through 10, just walking through them, remember step 1, body substance isolation, or BSI. Why do you think that's so important? Well, we know that it prevents further spreading of disease, mainly via feces, urine, and saliva. It's a method of infection control that actually just assumes that all body fluids are potentially infectious. And then we know that an effective task-specific barrier placed between the medical provider and the casualty can help prevent that spreading of disease. All right, now I went through those steps pretty fast. So now we're going to watch this in action, see the 10 steps going through with a video from Deployed Medicine. This is an awesome series of videos, and we're going to watch this together. Stick with it. It's only a little over a minute long.
Hi folks, Zach here. We're going to be going over wound packing today. The Committee on TCCC approves 3 types of hemostatic gauze: combat gauze, Celox gauze, and China gauze. Once you have identified a wound, hold pressure, direct pressure, and expose that wound. Go ahead and try to identify the major bleeder or any other bleeds within that wound. We're going to hold pressure on that wound. Open up your combat gauze. Make a small ball. 1 for 1, replace the finger that's holding pressure against the bleed until you've packed that entire cavity. Again, 1 for 1, maintaining pressure while you're packing and ensuring that blood isn't seeping through or around the combat gauze as you're packing it. You're going to continue to pack, maintaining pressure the entire time you're packing. Once you've packed the entire wound, hold pressure over the wound, ensuring that blood isn't seeping around or through the combat gauze. Hold pressure for 3 minutes. Once the 3 minutes is up, and it's time for a pressure dressing.
All right, so that's hemostatic. And he just said, now it's time for a pressure dressing, which we're going to talk about now. So applying an emergency bandage also has several steps. Step 1, again, we're going to conduct that BSI. And we're going to expose the wound, pack that wound with gauze, and that was all of that hemostatic dressing that we just talked about. Now, with an emergency bandage, there's a white portion on the dressing that you want to press down over the wound, directly covering the entire thing. You're going to wrap the elastic portion of that bandage around the extremity. Then there's a little pressure bar involved that you'll take that elastic wrap and insert it through. You're going to pull the bandage in the opposite direction applying pressure and using tension and leverage to get additional pressure over that pressure bar and over the wound. You're going to continue to wrap tightly, covering all edges of that wound white pad. And then you're going to secure that closure bar to the bandage and monitor for continued bleeding. Now, if the bleeding's controlled, you can then secure the bandage with tape. However, if it's still bleeding, you'll need to apply a CAT tourniquet until that bleeding stops. Distal pulse is absent, and then you can secure that with tape. So when you're wrapping the bandage, why do you think you pull the bandage in that opposite direction after passing it through the pressure bar? Now, I know it's probably hard if you've never seen this before to even imagine it, but understand that you're wrapping one direction around, and then when you get to that pressure bar, you're going to pull the opposite direction. So think of things like ratchet straps and having that additional tension pulling the opposite direction. All right, so we're going to watch this again from Deployed Medicine, and they're going to cover how to do this emergency bandage.
Hi folks, Zach here. We're going to be going over pressure dressings. The pressure dressing that we're going to be using today is the emergency trauma dressing commonly found in the IFACs within the Army. Once you have the wound packed, again, we're going to use the 1-for-1 replacement here. So I'm going to maintain pressure using my thumb, any other digit that I can, and then I'm going to expose the sterile portion, which looks like this. Place it over the combat gauze. And as I wrap, maintain pressure, being sure that I don't pull the combat gauze off of the wound, out of the wound, and being sure to lock in the sterile field that's over that combat gauze. Short tugs to ensure that we're tight. Until we get to the Velcro portion of the emergency trauma dressing. There's a locking mechanism on this dressing. Once we've Velcroed, we want to pull up a portion of the wrap and secure it in place with these teeth. That completes pressure dressing.
Now, in that video, you would have noticed that that one didn't have a pressure bar because that was not the Israeli bandage. But I do encourage you to go look up how the Israeli bandage works. It's just a little bit different, but they're all meant to do the same thing of that emergency pressure dressing. All right, so now let's talk occlusive dressings. Now, these are clear dressings typically used, best example would be for a gunshot wound in the chest area. So the steps for this, again, there's several. We're going to conduct that BSI and expose and take a look and assess that actual injury. Then you'll take that clear dressing, cover the wound, wait for the casualty to do a full exhale before you fully stick it down. Then you're going to actually log roll that casualty, and don't forget this step, to examine the back for an exit wound. Because likely there's a high chance that there's going to be an exit wound that you'll need to take care of as well. So in step 5, if there is an exit wound, you're going to also cover that with another occlusive dressing once they take that full breath out. Then you'll place that casualty in a sitting or a recovery position, and then do verbalized assessment, continued assessment for signs of respiratory distress. So you're listening for them to continue having trouble breathing, and this will show whether or not your occlusive dressings are working or if there's additional steps that a medic needs to take. So why do you think the Army standard for an occlusive dressing is 3 minutes or less, getting it on the patient within 3 minutes? Well, in the case of any type of open chest wound, this measure is done as quickly as possible because the casualty is not able to breathe. They're not able to breathe fully and well. So we need to get that on as fast as possible to ensure the best way to get them breathing and breathing well again. So why do we need to have the casualty conduct that full exhale before adding the dressing? Well, because if you put it on during the inhale, it creates a vacuum that's necessary and aids in establishing the initial dressing seal. Doing the opposite is kind of like adding glue or gluing a patch onto a deflated balloon. All right, so let's check out another video from Deployed Medicine, and they're going to show exactly the in-action steps of what we just walked through.
Hi everyone, I'm Joe. Today I'm going to be talking to you about the application of a vented chest seal and an occlusive dressing, and also we'll be going over how to burp the occlusive dressing. Step 1, we're going to inspect the thorax. Once you notice that there's a thoracic injury, peel open our occlusive dressing and remove it from its package. And if you have a 2x2 or Curlex, wipe away the blood away from the side of the injury. Apply the vented chest or occlusive dressing upon exhalation. Reassess. Be sure to log roll your patient and check for a downside wound. Inspection of a downside injury, wipe the area away, and apply an occlusive dressing. For demonstration purposes, I'm going to be applying the occlusive dressing on the downside injury. And again, apply upon exhalation. And reassess. And that concludes the application of the vented chest seal and the occlusive dressing. Now we're going to talk about burping the wound. Upon reassessment, if you notice any clots formed or any increase in respiratory difficulty, to burp the wound, simply peel back the chest seal, clear any clot away from the area, and reapply the chest seal upon exhalation. After burping the wound, we're going to continue to reassess our patient. We're going to monitor for the development of a tension pneumothorax and document all care on a DD Form 1380.
All right, so now let's talk eye injuries and applying a rigid or Fox eye shield. So with this one, what you're going to do first is perform a rapid gross visual acuity examination. And the video is going to show this a little bit better than I could explain it. You're going to position the casualty with their head supported, have them close both eyes, except if they're in a tactical situation. Then you're going to apply the garter shield cover or tape to the edges of the rigid eye shield. At that point, you're going to place that shield over the injured eye and secure the eye shield with tape. Then you're going to have them take 400 milligrams of moxifloxacin tablets from their combat pill pack, which you can find in their IFAC or improved first aid kit. And then you'll document the treatment, their visual acuity, and any medication administered on that TCCC card or the DD 1380. Now we're going through these steps pretty quick, but according to your reading, if you'd pulled that up, or if you know maybe just from personal experience, or maybe you've got some medical background, what else do you think you could use in place of this rigid eye shield? Now, if you've never seen one before, they kind of look like a round, almost cheese grater style. So it's hard, it's metal, and it's got a lot of holes in it. So if you don't have one, you could use anything from a SAM splint, some styrofoam, or the plastic cups, anything to keep kind of their eye covered and sterile. Now let's check out one more video here from them.
Hey everyone, I'm Stefano, and I'm going to be discussing proper application of a rigid eye shield in accordance with TCCC guidelines. Our first step is to conduct a rapid field assessment of the casualty's visual acuity. Please cover your unaffected eye. Can you read this card?
I cannot.
Can you read this card?
I cannot.
How many fingers am I holding up?
I can't see it.
After determining that the casualty's visual acuity is affected, we are going to apply a rigid eye shield. Please hold that in place. It is important to not apply a pressure dressing over the affected eye. Yeah, let go. In a tactical situation, it is preferred to keep the unaffected eye uncovered. After securing the rigid eye shield, be sure to administer your casualty's combat wound pill pack, specifically the 400 milligrams of moxifloxacin PO. Continue to reassess your intervention, assess the casualty's vitals, and document all patient care on DD Form 1380.
All right, so then we're going to talk one more thing here, performing first aid for burns. Now, there's just the 5 steps here, but it's pretty important and it can look different depending on the environment. So first, the very first thing we want to do is eliminate the source of the burn. Now, where it's already important is understanding what the burn is coming from, because eliminating it could look different depending on what the burn is happening from, right? We want to uncover the burn as long as we're outside of a chemical environment. But you never want to remove any clothing that's stuck to a wound, and you don't want to drag any clothing over burns either. Essentially, I always think of the idea of degloving, because it's stuck. It's there. If clothing is attached to or burnt onto the skin, it's actually going to create a much larger problem if you peel it back outside of a sterile environment. Then you're going to apply the casualty's dressing over the wound. Then you're going to observe the casualty for any life-threatening conditions. So you're going to watch for additional injuries and treat for shock, which is something that you learn in a whole different class. So you'll need to look that up on how to treat for shock. And then the last step is, of course, seeking medical aid. So why do you think it's prudent to take into consideration your environment before you uncover a burn? Why does it matter if you're in a chemical environment? And it doesn't even apply just to burns, it can apply to any open injuries. Well, chemical environments can absolutely contaminate a wound and make it far worse. So always keep that in mind. All right, now this one is going to it comes from a different channel here, but it covers the first aid for burns steps. So we'll check this out together, about 2 minutes long.
Perform first aid for burns. Conditions. During daylight, you see a casualty who is suffering from a burn. Test standards. Within 2 minutes, perform first aid for burns. Performance measure 1. Perform first aid for burn. Alpha. Reassure the casualty.
You're going to be okay.
Bravo. Eliminate the source of the burn. Charlie. Applied the casualty's dressing. 1. Applied the casualty's dressing pad directly over the wound. 2. Covered the edges of the dressing or pad. Properly secured the bandage. 4. Applied the dressing lightly over the burn, but firmly enough to prevent slipping. Delta. Watched the casualty for life-threatening conditions, sought medical aid.
All right, so that's performing first aid for burns. Now, let's move forward to the aftercare and what we do after we do any kind of medical treatment. Imagine you have a casualty that's been medically treated and you have to record that information. What are you going to use? Well, it's that DD Form 1380 Tactical Combat Casualty Card, or the TCCC card. And you might notice that this is a DD form, which means it's from the Department of Defense. And if you've noticed over time, sometimes we have DD forms, sometimes we have DA forms. The difference being DD is Department of Defense, DA is Department of the Army. Now, this being a DD form means that it's used across all branches of service. So regardless if you are Army, Air Force, Navy, Marines, it doesn't matter. This form is easily read, understood, and filled out by anybody in those fields. Now, why does this matter as much? because you might be in the Army treating an Army casualty, but you're going to pass them off to somebody else that may be an Air Force doctor or a Navy doctor. So they also will be able to read what medical treatment you did, and it's just a standardized form that works across all service components. So what does that look like? This is your TCCC card right here. It's a medical documentation tool that's used in combat settings, and it's used to record any kind of treatment provided to injured personnel. Now this is found within an individual's IFAC, so it's that small little first aid kit that they carry on them. They have one in there and you would utilize theirs. The key info that you're going to want to be able to fill out is any type of injury, the treatments that you provided, to include tourniquets, medications, dressings, and their vital signs over time. Now it's attached to the casualty once it's filled out, not with their bag or next to them. It needs to actually be attached to them, whether it's a belt loop, on their wrist, and that way there's a continuity of care that follows them as they move through that medical channel. The goal of this is to improve their survival rate and have accuracy in the medical treatment going forward during any kind of combat operation. Now, if you have the QR code screen pulled up, you'd be able to click either on that casualty care card or on that link below it, and it'll pull up the full version of that card because there is a front and back side. So why do you think there's a standard form for reporting all injuries? Well, we kind of talked about it, right? Uniformity, brevity, and efficiency. It's the first and sometimes the only record of treatment for any combat casualties. So accuracy and thoroughness of information provided is very important. You have to make sure if you're the one filling that out, that it's correct, it's timely, there's no information missing. That way it doesn't get missed or something doesn't get double done to somebody when they get passed on. Now, why do you use the casualties card from their IFAC instead of your own? Well, just like any of the bandages that you should always be pulling out of their IFAC, if you use yours and they get evacuated, you've just lost your own resource. You always utilize the resources within the casualties first aid kit. All right, so now how do we move them? Well, this is pretty simple. You're going to remove the casualty from a vehicle if it's necessary and do the treatment. Then you'll figure out the appropriate method for actually transporting them, or casualty evacuation, CAS-evacing them. Then you'll move them, and then you'll load them into a military vehicle at some point, right, to the CAS-evac. So when we're talking about performing casualty movement, we're talking about getting them away from where they just got hurt and getting them to a vehicle that can get them help. That's the movement that we're talking about. Now there's 3 different transportations that we'll talk about in this lesson. We've got the manual carry, which is self-explanatory, right? They are moved by personnel from one spot to another. Then we've got the talon carry, and I'm sure you've seen this litter before. It's the pole litter that folds out. Fairly easy to carry, but very easy for medical personnel to carry and move a casualty with. It's flat, it's got the nice strong poles, and then you've got the SCEDCO or the SCED litter. From my experience in ROTC as both a cadet and a cadre member, this is the most annoying way to carry because it doesn't fit right on your gear, it's hard to carry around, and then it's more of a drag. So I consider this more like a sled, but that's another way that you can move a casualty. So you'll notice that in the steps prior, it says choose the most effective form or the correct and most appropriate form of movement, and then move the casualty. Now the appropriate could be, what does your environment look like? What are your resources as far as personnel that can help? And what does the speed need to be? How far are you going? So a lot of different things that can come into play when you're deciding what transportation method to use. All right, so why do you think you should rehearse transporting a casualty? And I'll ask you this, if you've been in ROTC and you've participated in your leadership labs, have you actually performed the rehearsal during a tactical lab? So while the MS3s are planning, have you and your team at any point, maybe during FTX, spent time rehearsing the actual transportation of a casualty using the resources that you have at your program? Well, if you haven't, I encourage you to start pushing for that, because depending on those conditions, the environment, the enemy situation, and casualty size, it can be different how you do it every time. And like I said before, most transportation situations are driven by the resources or lack thereof. So you're going to have to use various techniques which need to be practiced. It's not very effective to just pull out a towel and litter if you don't even know how to unfold it, how to secure a casualty to it, how to lift it correctly. Same with the SCEDCO and same with manual carries, right? It can look different if all people aren't on the same page and haven't done it before. That casualty is probably going to suffer more damage just being transported. So push for those rehearsals and get some hands-on practice with it yourself. All right, now like I said, we're going to touch on the MEDEVAC Request Card, but this is covered under other lessons, or maybe you're in Ranger Challenge and you've probably practiced this quite a bit, or you will at some point. But the MEDEVAC Request Card is what we call up to get a helicopter to a helicopter landing zone, or an HLZ, to medically evacuate our patient out. Now there's a form, it's a step-by-step 9-line, you'll hear it called the 9-line card, 9-line MEDEVAC card, that we use for injured personnel. And we use it to communicate essential details for a timely and efficient MEDEVAC. The key info that we need for this, we always say the first 5 lines are the most important. First 6 lines, you need to know the unit location, the number of casualties, what types of injuries they have, the pickup location, so you're going to do casualty movement from your site to the pickup location, and any special equipment that bird needs to have on it. Now, with it being in a 9-line format, it follows a standardized format that way for quick transmission over the radio. So line 1, blah, 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 line 2, blah, 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 line 3, blah, blah, blah. It's very quick and efficient because you need to get that bird in the air and to your location as fast as possible, which leads into the goal of ensuring rapid medical support and evacuation to get them to higher levels of care. Once again, if you have this open on your own device, you could click right here on this card or down here on this link, and it'll pull up the full front and back with the instructions of a medical card. All right, so that was a ton of information. And it's even harder because it was information spoken at you with maybe a little bit of applying it through videos. But again, you've got to get the hands-on practice. Being a prior 68 whiskey when I was enlisted, I still would need to practice these things on a regular basis because first aid is a perishable skill. And it's one thing to tell you the steps of doing something. It's a whole different thing to understand how to open those dressings, pull them out, the best way to tighten them down. You've got to get the hands-on practice. So get with your peers, get with your cadre, your leadership in the advanced portion of the course of your program, get some medical supplies, and get to practicing. I hope now you feel better about explaining and hopefully demonstrating at some point how to apply the hemostatic dressing and emergency bandage, as well as an occlusive dressing and the rigid eye shield. And I hope you have a little better understanding of how to perform first aid for burns and the main steps involved. I hope also that you can initiate a DD Form 1380, but again, that's going to take practice. Download the card, Google image search it, find it, and start filling one out just for fun. And then, of course, we talked about some performance of casualty movement and really understanding that it needs to be rehearsed. And the way that you move and the method of movement is going to depend on the conditions and environment that you're facing. Now, if you do have more questions on this, go find your primary advisor, your instructor, get a high-speed MS3 or MS4, go run some questions by them, do some practices with your peers. You don't need a lot to do practicing. And then if you still have questions, depending on when you're watching this, you're always welcome to try to reach out to me at silver.beatty, B-E-A-T-Y, at mso.umt.edu, and I can try to answer or at least direct you to the right people that can. As always, thanks for sticking with me. This is a tough lesson to teach to a computer, but I appreciate you still being here, and I'll see you on the next one.